Welcome to this video in which we are going to talk about what your baby's face will look like right after birth. Soon after birth, you will find that the face of your baby is a bit puffy and a bit swollen. This is mainly because of two factors. Number one, because of excess fluid in the baby's body, and number two, because of the rough journey and the rough ride that the baby has gone through while coming out of the mother's womb. The facial features may be a bit distorted, the ears may be twisted, the nose may appear flat, the eyes may be a bit distorted, but all this is temporary, and in a few days' time it will all change. So the pictures that you see of your baby at the time of birth will be different to what you will see in a week's time. Most babies will open their eyes minutes after birth. For some reason, if the face is very puffy, they may only open the eyes partially. One easy and a very good way of helping the baby open the eyes is to rock the baby in this direction. As you rock the baby and the baby goes in this direction, the baby opens the eyes. This is also called the doll's reflex. Many mothers ask me, can my baby see at birth? Of course, the vision is fully developed weeks before the baby is born. However, the baby can only focus up to a distance of 1.5 to 2 feet from the face, and the baby primarily sees black and white for the first couple of months. So that's why when you hold your baby close to you, the baby will look into your eyes, into the color of the eyes, or if you have dark hair, at your hair. That's why we often recommend that the crib hangings and the crib toys should be black and white for the first couple of months. You might also try something very interesting. If you take some black and white flashcards, like the ones that I'm showing you, this is from another program of ours, different patterns, and if you hold these close to the face of the baby within a distance of 1.5 to 2 feet and move in a particular direction, the baby is going to look and follow these cards, this pattern. This is also called tracking. And you'll be surprised how a 1-day-old baby or a 2-day-old baby does this. Many times mothers get worried because they see some tiny red spots in the corners of the eyes. These are tiny hemorrhagic spots because of the trauma that the baby has gone through at the time of birth. And this is just a tiny hemorrhage in the outer covering of the eye. It has nothing to do with the inside of the eye. It does not interfere with vision, does not cause any injury, does not cause any harm. It does not require any treatment and will usually go away within a week to 10 days' time. Many mothers like to know what will be the permanent color of my baby's eye. Well, the color that's there at birth changes over a period of months, and the permanent color of the eye is what you see when the baby is at about 6 months old. Now, as I said earlier, sometimes you might find that the ear may be a bit distorted or twisted. This is mainly because the cartilage in a newborn is very, very soft. It is not as firm or as well developed in an older baby. But this again just settles down with time. Sometimes you might find small skin tags close to the ear. These are usually harmless, and you can ask your doctor as to the timing when they need to be removed for cosmetic reasons. Your newborn mainly breathes through the nose, and there's a lot of turbulent noise that comes from the nose because the nasal passages are small. And as the face grows, as the passages open up, this noise goes away. So for the first few weeks, if you find a lot of noise coming from the nose, don't worry about it. If you find any mucus secretions coming out, you can always use a little aspirator to try and get rid of the secretions. When your baby opens the mouth to yawn or to feed, you might find some white patches or white dots on the roof of the mouth. These are called Epstein pearls. This is normal, not a cause for concern, does not require any treatment. So this was by and large what you would expect from your baby's face. In the next video, we are going to talk about the other parts of your baby's body. Thank you for watching this video, and I shall see you in the next one soon.